first went to the mental health component. So people living with diabetes already are at a higher risk for things like isolation, anxiety. There are also social stigmas that they experience. And so there's already a mental health burden on those living with diabetes. And when something like COVID comes along and isolates everybody from each other, where a higher percentage of people now are reporting similar things, anxiety, depression, um, we have this intersection that can be really it can be really serious if not attended to. And so that's one category that I think is really important to pay attention to is if you're living with chronic disease, with a chronic disease, then it might be a particularly important time to be aware of your emotions and your kind of mental states, and draw upon appropriate resources in this time. The other thing that I think everyone is experiencing, but perhaps those in particular who are living with chronic diseases, is this sort of existential nature of this experience we're all going through. It really has disrupted the ways in which we connect with people, the ways in which we connect with our work, the ways that we go about our daily routines and our life. And when you're managing a chronic disease, you have to be very careful about your lifestyle, and you may be you may have a more strict routine than others in terms of exercise, in terms of diet, in terms of your daily activities, movement, sleep. So then when this gets layered on top of all of that, and it becomes very disorienting. And so I think there's if we talk about spirituality in terms of the way we connect, a lot of those connections have been disrupted. And so there's that kind of spiritual component of it as well, wrapped in there with mental health and obviously physical health as well.